Hello, I'm Dr. Shah. At Norwich Ophthalmology Group, we're committed to optimizing your lifestyle experience by offering the most advanced technologies available. One of the most exciting advancements that we now offer is the ReZoom lens. The ReZoom implant provides the overall full range of vision that I think you as my patient needs. It provides sharp distance vision, critical intermediate vision, and actually versatile near vision as well. The ReZoom lens is a premium multifocal lens implant that is designed to allow patients to see near, far, and everything in between. Now, most people that I implant the ReZoom lens with are able to read, use a computer, and even drive a car without having to depend on glasses for most or all of the time. This video will educate you about the ReZoom lens and maybe help you decide whether this lens may be right for you. So sit back, enjoy the video, and after you've finished, I'll meet with you to review what you've seen and to discuss all your treatment options. See you soon.
Hi, I'm Gary Player. If you're like me, you don't like to lose. Whether it be in a golf tournament or your ability to read without glasses. When you get cataracts, it affects everything. Driving at night, using the computer, cooking, you name it. You can't see anything well. My caddy got the nickname of Fairway Bob because every time I played, it was so embarrassing, you know, having had great eyes all my life. I'd hit the drive and I'd say, "Fairway Bob." In other words, I was asking him if the ball was on the fairway. Well, all these other caddies heard this every single day, and eventually they called my caddy Fairway Bob. Now I can stand there and say, "Bob, that ball's on the fairway. Can you see it?"
Vision often declines as we get older due to changes that take place in our eyes. Sometime after age 40, most of us experience difficulty seeing things up close. Ultimately, we end up depending on glasses or bifocals to read. This is one of the first signs of an age-related condition known as presbyopia. Cataracts are another common condition affecting our vision as we age. Having cataracts and presbyopia can substantially compromise your vision and affect every aspect of your life, from reading and using a computer to cooking, watching TV, and driving, particularly at night. To understand presbyopia and cataracts and how these conditions affect your vision, it's important to understand how your eye works. Here's how it works. Light rays first pass through the cornea and then through the crystalline lens and are focused onto the retina. From the retina, these light rays are sent as electrical pulses to the brain, where our mind sees a picture of what's in front of us. With presbyopia, the natural lens of the eye begins to harden and becomes less flexible. This diminishes the eye's ability to switch its focus from one object to another at different distances. Over time, while distance vision may still be very good, near vision gets progressively worse. Presbyopia usually occurs before cataracts and affects almost everyone over 50. Eventually, reading glasses or bifocals become necessary for reading, and frequent changes in eyeglass prescriptions are common. Cataracts also involve a change to the natural crystalline lens of the eye. As we age, the natural lens of the eye can get clouded. Light rays become scattered and no longer pass clearly through the retina. At first, this cloudiness may affect only a small part of the lens, but over time, the cataract usually becomes darker and harder, and vision decreases significantly. As cataracts develop, all objects, whether near or far, become blurred, and vision usually worsens. One of the first signs of a cataract is the loss of the ability to see in low-light situations or at night. Other indicators include hazy or blurred vision, faded colors, and sensitivity to light. The only treatment for cataracts is to remove the clouded natural lens of the eye and replace it with an artificial lens implant. Today, this procedure is very common, and over 14 million are performed worldwide each year. While traditional cataract surgery with conventional lens implants is successful, it is limited because it only provides good vision at a single focal point, either at a distance or near. But we live in a world where we need to see near, far, and everything in between. That's where the advanced ReZoom multifocal lens comes in. The ReZoom multifocal lens is designed to provide a full range of vision and greater independence from glasses. In fact, most people who have had the ReZoom procedure no longer have to depend on their glasses all the time. In a survey of patients with ReZoom multifocal lenses, 92% reported never or only occasionally wearing glasses after the procedure.
The ReZoom procedure has changed my entire life. I'm able to now sit with my grandchildren, 17 of them, and I can read to them, whereas before I really couldn't. The ReZoom procedure definitely has changed my golf game. I obviously don't have the ability I had when I was 20, but I'm able to see the ball land, I'm able to see it on the green, but above all, I'm able to really read the green well now. That's imperative. If you don't read the putt right, you're never going to make it. So that's changed everything. I can read the line and I can see the distance, and I'm really enjoying my golf.
The ReZoom multifocal lens represents 20 years of research and development by optical engineers with one goal in mind: greater independence from glasses. You can see how the ReZoom multifocal lens is designed with balanced view optics, a series of special visual zones that focus all of the available light entering the eye for near vision, far vision, and everything in between. This advancement in lens design means that many people can regain vision like that of their youth. And for those of us who didn't have good vision in our youth, it has the potential to provide a level of independence from glasses and a range of vision that we have never had before. Imagine being able to read a label, see a computer screen, cook and shop, or drive a car without depending on glasses all the time. ReZoom has helped thousands of people like you resume their daily life with a brief 30-minute procedure and little or no downtime.
It was quite astounding. I played in the Masters this year 1 week after my ReZoom procedure in my left eye. And I got there and I was one of 2 people to birdie the first hole. In fact, nobody birdied it within 3 hours of when I did it. And that was so encouraging, because to go into a major tournament like the Masters, just having had the operation 1 week before, I didn't think I'd be able to compete. And I shot 79 and beat a lot of guys at 70 years of age.
To find out if you're a candidate for the ReZoom multifocal lens procedure, ask your eye doctor. During a thorough eye exam, your doctor will conduct a series of tests to determine the health of your eye and whether you're a good candidate for a ReZoom lens. At that time, your doctor will discuss your treatment options and review all important safety information, including potential risks and side effects of the lens and the procedure. Halos and some glare around bright lights during the first few months after the procedure are common, and in most cases diminish with time. Your doctor will explain this and answer all your questions. If your eyes are healthy, your decision will be based on your lifestyle. What activities are most important to you? Are you active and motivated to be independent of glasses and contacts in most situations? Would you like to read without needing glasses all the time? These are a few of the key questions your doctor and their team will discuss with you as together you determine if the ReZoom lens might be right for you.
The ReZoom procedure that I've had has been one of the greatest things that have happened to me in my life, because to be able to see is a miracle. People take sight for granted. To be able to see is something we should go on our hands and knees every day of our life for. I can read without contacts, without glasses. I can see far, near, and in between. And people are always scared to have it done. I was scared. I was reluctant. Thank goodness I had it done.
Imagine getting up and going, not having to keep track of reading glasses, or exercising, driving, shopping, cooking, reading, and working on the computer without depending on glasses all the time. If poor vision is affecting your lifestyle, you owe it to yourself to ask your doctor if ReZoom multifocal lens might be right for you.
Now, thanks to ReZoom, whether I'm reading a putt, reading my email, or reading to my granddaughter, I've got my Zoom back.